Welcome to chapter 2 of my Graphy. It's titled The Miracle It Aims. The ending is not known to this miracle. This miracle is for me. I'll leave it up to you to decipher the ending for yourself. This is about 8 years ago. I was posted in the pediatrics ward in AIMS New Delhi, and it is one of the best care you can get as an Indian in India. Our pediatrics department is really great. So when you think about pediatrics department, you will think that children are laughing and they're crying because of injections and so on and so forth. I also had similar expectations from that posting, but then suddenly at one day there was one patient, and I went next to her. I'll not name her. So she was around 6-year-old, and when I read her file, so there used to be a file which was hanging from the bed of the patient. So I saw that she unfortunately has what is called as acute lymphoblastic leukemia, ALL. Commonly people call it blood cancer. And she was just 6 years old, and every day she had a lot of these piercing marks on her body, because every day people used to take blood samples from her. And I was just seeing, the nurse was standing next to me, and when she was just reading a book, and the nurse took her hand and took this blood sample and just like walked past by me. So most of the children, when they get vaccinated or when they get injections, they cry. She was absolutely immune to the pain, and she was taking chemotherapy for last 1 to 2 years, and she had to go through a bone marrow sample just for the diagnostic purposes. And I still remember very clearly that her mother was sitting next to her, and she was given a 30% chance of survival. Like, I'm choking up right now just to think about that. Like, it's been 8 years ago. She was given a 30% chance of survival, and she was the one who was consoling her mother ki mama, koi baat nahi, it will be all right, don't worry, I'll come out of it, doctors are trying their best. And her mother is crying incessantly, and the daughter is actually consoling the mother. And I also, like, went teary eye. Usually I don't cry, but I also became a teary eye. I gave her a chocolate, what I could at that point of time. I couldn't help her much. And she was studying for her schools. Now there's a girl who doesn't know whether she'll survive after 6 months or not. She's 6 year old, maybe 7 years old, about to turn. She's consoling her mother. She's getting an injection done. She's absolutely immune to the pain. Pain is like, she doesn't care about that, because that is what she has been going through in her little life for last 2 years. She's been going through on and off chemotherapy sessions. She doesn't know whether she'll be alive after 6 months or 12 months or 1 year or 2 year. Her 5-year survival rate probability was 30%. There is 7 in 10 chance that she was not alive after 5 years. Now, unfortunately, I wish I could tell you the end of this story. I didn't follow up. After 3 days, she was out of her ward. She got her treatment done, and then she went home. What I'm trying to tell you from this story is that, would you change your place? Like, if I give you a dream or a wish, would you change your current situation with that child? 99.9999% of you will not swap the places with her. When you don't know whether you will survive after 6 months or 12 months, and you're 6 year old, you've not seen life. This is the only life you know, of medicines, of pain, of trauma, of chemotherapies and chemicals and poison running through your veins to kill your own cells. So the point which I'm trying to, from that point onwards, I have like made up my mind. I will never complain. I will never criticize or crib or do any sort of activity where I'll say, okay, I'm in such a dire scenario that there is no way out of it. I said, that is not a dire scenario, my friends, where you are right now. I have seen dire scenarios in my life, and trust me when I tell you that mother, you can't be that mother or that child. Will not swap your places even for 1 second with them. So you are relatively very lucky. You are just facing some obstacles, some problems, and that can be solved. Do not blame your circumstances, do not blame your resources, do not blame your parents, do not blame the place where you are born, the college you have been to. If things are not working out, it is a problem, and like every problem, it can be solved. Now, whether you take the blame internally and process the problem in a creative way, that is up to you, or if you put it blame on the external world, that's also up to you. Whenever the problem is externalized, it is in easy language, it's called as an excuse. Now imagine that 6-year-old girl was preparing for her exams. She was very optimistic about it, that hey, I'm going to survive this chemo, I'll kick ass on this cancer, this ALL cannot defeat me, though they have given me a 30% chance, I'll still come out with it flying colors. That's still better odds than a patient suffering from, let's say, other type of cancer. So she was telling me that there is another cancer called as AML, and the prognosis is like really bad in that, sir. I was like, then that's the moment when I cried, that she knew that there is another type of cancer which is common in like 1-2-year-old kids, and they don't even survive to that age. So don't think that you are in a dire circumstance, don't think that you have big enough problems. Any problem, whether big or small, cannot be compared to that miracle at AIIMS which happened about 8 years ago, and that incident is as fresh in my head. I still remember the sheets of that bed. I still remember the ward. There were 6 patients. She was sitting right next to the window. Her mother was on a plastic chair, the file hanging from the bed. And the 2 things which we can learn from all this is that don't complain, don't crib. Whatever you have gotten, whatever hand you have been dealt in life, try to play it in the best possible way. And second is, if that girl, knowing that she might not survive after 1 year or 2 years, and she has a 30% chance of survival, if she can prepare for her exams in a school which doesn't even matter, if she doesn't study, like no one cares, right? But that very optimism, that very reason to live the next day, consoling her mother, saying that there are far worse things which can happen to me, preparing for the exams at the same time, that optimistic outlook, the positivity towards life. Maybe she survived because of that. I don't want to know the end to that story. In my head, I think she is alive and she is doing great in her life. If she is alive, she will be like 14-15-year-old kid right now, maybe in a 10th standard, going through her boards. But imagine the kind of grit, the tenacity she displayed, that I am telling you this story after 8 years, that has left a huge imprint in my life. That half an hour, 1 hour discussion with her, I can never ever forget that miracle at AIIMS. She came as an angel in my life. She taught me the most important lessons in my life. Another movie which talks about the same thing is Shawshank Redemption. I'll quote that. Hope is a good thing, maybe the best of the things, and no good thing will ever die. Please remember, be optimist, be hopeful, just like that kid. Believe in magic, believe in miracles. Even if someone tells you that you are going to fail, it cannot be worse than saying that you are going to die. There is a 70% chance, that you are not going to survive after 6 months or 1 year. If someone said that to me today, I don't know how I will take it. Maybe I'll go in depression, maybe I'll just go to some Europe, I'll just party. I can't work like that. It's just imagine a 6-year-old going through that. If she can pull through that, and if she can console her mother, if she can study on her exams, if she is focused enough that she is talking to me, a doctor at AIIMS, saying that there are far worse things which can happen to her, that she is lucky, relatively speaking, she is lucky that she has gotten that variety of leukemia. What scenario are you in that you are blaming your resources or your finances or your college or your education or your job or your parents or your neighborhood or your city? Stop doing that completely. It is absolutely useless. If she would have blamed herself, if she would have blamed her parents, her scenario, it would have come to no avail. The best thing she was doing was being positive, being optimistic, being hopeful about life, and that's what I carried on with me at an academy also. Whenever I have some doubts in my head, whenever I feel like that this is not going the right direction, this is not the things which we want to do, there are so many ups and downs, the growth is not coming, then I just think about that scenario and it gives me hope, it gives me motivation, it gives me optimism, and I just stop complaining. Okay, hey, this is the problem, I'm going to fix it. If she can be that optimist in such a scenario, I can do better than that. So never ever stop believing in miracles, they do come true. So guys, in the next chapter, chapter number 3, we are going to talk about take risks, be bold. I'm going to talk about my life, what risks I have taken and what I have gained from them. So stay tuned. I'll see you in chapter number 3.